Hi, I am Dr. P. Suresh, consultant ophthalmologist in Fortis Hospital, Mulund, Mumbai. Today I am going to talk about corneal transplant surgery, popularly known as eye transplants. First and foremost, I want to make it clear, the word eye transplant, there is a misconception that the whole eyeball is removed and new eyeball is transplanted, which is not the case, unfortunately. So when we mean eye transplant, we mean only corneal transplant. Cornea is the front clear window, like the watch glass, in front of the eye. When it is diseased, it can be replaced by somebody else's cornea who has donated it, and it's available from the eye bank. So the general question is, how successful are these procedures? Now, for corneal transplant, there are a variety of corneal conditions for which transplant is done. We categorize them into very high success group, moderately success group, and poorly success group, based on which we advise the patient accordingly. Corneas which have got only scars and no blood vessels on them do extremely well following corneal transplant surgery. Certain corneal conditions where the cells are damaged without any inflammation in the eye, they do very well. So these successful category really have a success rate of more than 90%. That means they retain a good cornea, very good vision, and they live several years without having further problem in the cornea. However, certain conditions where the patient's cornea itself has attracted some blood vessels, when we transplant in such patients, the rejection by the body is going to be on the higher side. Such corneas have to be maintained very closely for any sign of body rejecting the transplanted cornea, and the success rate changes accordingly. It becomes less successful if the cornea is totally got blood vessels and the eyes are very dry. Such cases, cornea transplants may not be very successful, and the surgeon may recommend against doing corneal transplants. However, patients who are desperate to have corneal transplant surgery because they have no vision in the other eye, they have only remaining cornea left, and when we have to do transplants are done in conjunction with physician, and we may consider using immunosuppressive medications like other transplant surgery like kidney transplant, etc. So in general, corneal transplant surgery, when carefully selected patients, are extremely successful and is given very good vision for people who are corneally blind across the world. And in this context, I encourage eye donation. Thank you.